So I'm Isaac.
I'm Lily.
I'm Danielle.
I'm Rocio.
And we did the Children's Bureau of Southern California. And it's located in Baldwin Park. And here's its vision. So our vision is to significantly change the lives of at-risk children by providing state-of-the-art child abuse prevention and treatment services, while increasing the scope, depth, and volume of services. We will engage in continuous discovery through research to determine and implement what works, and be a passionate advocate on behalf of children and families. They do quite a lot. And right now I'm just going to read off what's on the wall, but I'll talk more about it. Their mission statement is the Children's Bureau is committed to providing vulnerable children, especially in early years, the foundation necessary to become caring and productive adults by preventing child abuse and neglect, protecting and nurturing and treating abused children, enhancing the potential of families and communities to meet the needs of their children, advancing the welfare of children and families through superior programs in foster care, adoptions, child development, parent education, mental health, research, advocacy. And just a little bit of information regarding the agency itself. Its client profile is that 90% of families are below poverty line. It's located in LA County, but they do take in people from all around LA County. I mean, it's located in Baldwin Park, but they take in people from all over. 88% of their clients are Latino, 7% Caucasian, 3% African American, and 2% are Asian Pacific, or Asian. Okay, so as to the ways that the service is vital in reducing child abuse, what the Bureau, the Bureau accomplishes this. How does the Bureau accomplish this? Is number one, by teaching. That is, you work with community services to teach parents how to become better parents. Very simple. Teaching healthy, safe parental teaching techniques. They reach into in communities by giving out information on nutrition, health, discipline. Just try to reach. They try to go into communities by working with community centers. They empower parents by allowing them to volunteer and in the program itself by learning new techniques, giving them the tools they need to become better parents and to help themselves and help their children out. They prepare children by helping kids get ready to go into preschool, because they also work with preschool children. They respond to threats against children by implementing foster care and adoptions. In fact, last year alone, they did 400 temporary foster care cases, and they did 100 permanent adoptions. They provide children with the tools they need to succeed. They provided that last year. 45,000 hours of counseling. They do everything from sexual abuse to neglect to emotional abuse. They advance in the public sector by litigating on the part of the children, so they get into the politics, into the local politics, and try to see what they can do to help change society so it's more kid-friendly. And they train local community centers on how to work with children and work with families and direct them in the right path. So yeah.
As far as mental health services, about 28% of their budget is used towards mental health services. Services include comprehensive assessment, individual therapy, family therapy, group therapy. They do case management. They do assistance to significant caretakers and support persons in the child's life. The services are provided in the home, school, office, or community. The Children's Bureau utilizes a family system approach and engages the caregiver as a partner in problem solving. All treatment is customized to meet specific needs of the child and family. Part of what they focus on is mainly prevention and treatment, and in-home parent education and support. Families are screened for parenting risk factors before being enrolled in the program. Family support counselors and registered nurses provide the following in-home services for 1 year or more, which includes assessment, parent education, developmental screenings, health and safety education, insurance, immunizations, family and support, and case management. Another part of their prevention effort is kindergarten readiness, which is serving children up to the age of 5. And they use the creative curriculum, which is an extensively researched and validated learning model for preschool children that help develop their skills and awareness to become successful and lifelong learners. family resource centers. The FRC is a team of collaborating agencies working with parents and local businesses in the neighborhood, and they provide comprehensive services and support. Their goal is to decrease isolation by connecting families with the community and providing services that strengthen family functioning. And their services include parent education, after-school activities, domestic violence counseling, and legal assistance. And because they focus primarily on Spanish-speaking language, they offer English as a second language. Another prevention is New Parent, which is it's a unique program that they have that covers all ages and stages of child life from birth to 5 years of age. They focus on helping parents to become the best parents they can be. Parents participate with their children to enhance and improve both the learning and bonding processes. Part of their treatment is foster care and adoption, which plays a big role in their agency. And they help find homes for children from newborns to 18 years of age. And their foster and adoptive parents are given the support and resources to help the children that they adopt or foster. And of course, they have mental health services.
Methods used to anticipate clients' needs. Before the clients receive services, they have to go in for an initial interview, which is called an intake. The intakes are assessments of the clients. They're very specific. They have different ones. So it could go by age range or ethnicity or religion. So it's based on the client. It's not just one whole general intake. The agency has an intake coordinator who specializes in finding the perfect, the appropriate therapist to the client based on the what the therapist specializes, so that it'd be a better match for the client and the therapist. Instruments to measure client success. The Children's Bureau uses 3 instruments. They use the prevention and early intervention, the evidence-based practices, and the youth outcome questionnaire. The youth outcome questionnaire uses measures used from ages 4 to 17. It's 64-item questionnaire for parents to measure youth progress. And the YOQ is given at the intake and every 6 months. And after every 6 months, they could see what the outcome is, the progress, what they need to work on more, or what they're improving.
One of the questions that we asked was if they collaborate with other agencies, and the Children's Bureau connects with clients from other agencies who can serve the client better when they lack the resources to enhance the therapy with clients. As we were speaking to her, she said that there's a lot of, due to the budget cuts, sometimes it's really hard for them to provide certain services. So they definitely go out there into the community and see what other agencies are doing, and then they partner up with them. Currently, like I said, the funding, they do not have enough funding for parenting classes on site, but the agency decides to refer the clients to other agencies who are providing those classes, and the idea is to make sure clients are being served at all times. The qualifications they require for their staff is they must be registered with the BBS, which is the Board of Behavioral Sciences. They have to be as an intern or licensed marriage and family therapist. In order to be an intern or licensed staff, the person must complete a master's degree, which allows them to be in marriage and family therapy, internship, and future license. For this specific location, the staff must be bilingual in English and Spanish, with the exception of 2 positions. What training do you supply for your staff? They have different training depending the staff. For therapeutic staff, they must attend all required trainings. For the evidence-based practices they provide service for, training in safety, child abuse laws, and mandated reporting, initial assessment, care plan training, adoption training, and how to be an advocate in court for the clients. And for the manager or program supervisor, they train in how to do good supervision, ethics, laws, sexual harassment training, guidelines to related client hospitalization, and other things.
Societal values. The pro of Children's Bureau is funded by car tax. The con is if the public is not purchasing cars, the agency loses its funds. But the good thing is, new cars are always coming out. People wanting new cars, so they're always going to get funding. Another con is many of the agencies' clients comes from illegal and undocumented families, and often those caregivers don't speak Spanish. So this requires a bilingual English and Spanish therapist to work in the families, possibly causing limitations. Hard to accomplishment and rewards. Gloria Danielle, she's the MFT. She said that it's the success of children and the families. Family preservation, so family reunification, keeping the family together is always their number one priority. If it's not, they try to look for foster parents and seeing children and family grow together in mentally healthy ways.
Thank you.